Let me give you an overview of who we have with us tonight, and then I will introduce each of them individually. They are all experts in the field of healthcare, and they are all in different factions of the field of healthcare. Dr. Benjamin Chu is the president of Kaiser Permanente, Southern California. Before he joined Kaiser Permanente, he was president for 3 years of New York City's Health and Hospitals Corporation, the largest of its kind in the country. He is an internist, an educator, and quite experienced in the academic field as well. He was at Columbia University. At both Kaiser and in New York City, he has been a strong proponent of the use of electronic health records, which we will have a chance to talk about today. We also have with us Jerry Flanagan, who is a healthcare advocate with Consumer Watchdog, one of the best known consumer advocacy organizations in the country. He is the lead advocate on healthcare reform and personal privacy issues. In the last year, he focused the national news media on the benefits of providing Americans with a public option to the private, or what some people call the profit insurance market. Francine Kaufman, Dr. Kaufman, is the Chief Medical Officer and Vice President of Global Clinical Medical and Health Affairs for Medtronic Diabetes. She's a professor of medicine and is one of the lead researchers and physicians at Children's Hospital in Los Angeles. Leva Lessin is the president of CareMore Health Plan, a Medicare Advantage company dedicated to the care of seniors, serving the chronically ill and frail in Los Angeles, Orange, San Bernardino, Santa Clara counties. She has had several executive positions at Pacificare, including president of North California Operations. We will begin tonight with Dr. Chu, president of Kaiser Permanente.
Thank you very much. Thank you very much, Dr. Hensel. Kaiser Permanente is very supportive of healthcare reform. Healthcare reform that will provide universal access to high-quality, affordable healthcare for all Americans. But we also want to point out that healthcare reform is about reforming the care delivery system. To change it from a system that's focused on episodes of care to one focused on health outcomes, not just volume of services. Care delivery reform is not just about coverage expansion, but it's also about, or cost cutting, but it's also about what we get from the care delivery system. I think we feel very strongly that we can achieve both cost-cutting and expansion with meaningful delivery system changes. We have to begin to reward prevention, early detection, and good chronic disease management, and most of all, coordination of care. I know all of us have experiences with the healthcare system. All of us have family members who've gone through the healthcare system, and it's really quite amazing when you have somebody who's ill trying to figure out how to navigate the maze and fragmentation in the healthcare system. So coordination is a key component of healthcare reform. And if we stay focused on these preventive measures and stay focused on using the tools that can be available through electronic health records, such as Hensel's right, I've been a very big proponent of using computerized health systems to track and see how well people are doing with healthcare, and to really proactively change how we approach healthcare to try to get people, the proper healthcare before something bad happens to them. we've been very supportive of state and national efforts, both the California effort several years ago and the national effort for insurance market reform. All of the things that we've been talking about, that Congressman Schiff talked about, Kaiser Permanente has been very, very supportive of. But it has to be done on a level playing field. All insurers have to play by those rules. But we're very, very supportive of that. We're also supportive of an individual and employer contribution to pay for some of the health care and to have health care coverage. Because it's the same principle. You can't have market rules where people opt out. You can't wait until you're sick to get insurance, because it's only the sick that will have insurance and will make insurance completely unaffordable. So I think we have to figure out how to pay for outcomes and not for volume. So bundled payments as part of this reform package, capitation the way we're used to it, Kaiser Permanente, where prepayment allows us to direct the money for preventive care as opposed to waiting for when you come into the hospital with an acute emergency. That's the kind of thing that we need to think about in the healthcare system. And of course, choice. Choice of plans, choice of doctors, and choice of hospitals have to be part of this system. Thank you very much.